Oh. Okay, we'll call the meeting to order. Was the meeting properly noticed? Yep. Roll call, do we have a quorum?
It appears that we do. We've got, Becky also on a call. Oh, yeah.
Okay, can I have a motion to approve the agenda?
Can I make a motion to move 9A, or no, I'm sorry, 9C to right below the number 2 department, reported department of human services.
Okay, have a motion to amend the agenda. Can I have a second, please?
So moved.
Motion made by Gordy, second by Rick, all in favor,
Aye.
opposed,
Aye.
Who was that?
who was that?
I think it was Becky.
Becky, was that you?
No,
Okay. Agenda approved as amended. Can we have a motion on the minutes, both the public meeting and the regular meeting from August 30?
I'll second.
Motion made by Rick, by Gordy, second by Rick, to approve the 2 minutes, meeting minutes. All in favor,
Aye.
opposed? Motion carried. Public participation,
No.
correspondence.
None.
Okay, we'll go on to new business. Veteran Service Officers Report. Rich, are you on?
Yes, I am, Marge. How you doing?
Good, how are you today?
I'm doing. So I'm gonna start out with our August report. We met with 46 clients. We had 301 phone calls and faxes, 231 electronic transfers. We had 7 outreach appointments and welfare checks. We had the mental health community action team, which Scott is on that thing. It's ongoing. And then we had the CVSO Congressional Liaison Meeting from Toma VAMC, just reviewing their procedures, going over Agent Orange, Thailand, burn pits from Southwest Asia, how they're trying to handle it. If anybody wants to go golfing, their new golf course is open to the public up there. And then community outreach activities, women's veterans healthcare they covered. Are there any questions on August?
No, there doesn't appear to be.
Okay, so instead of going over the financials, I'll cover that in September because there's not much difference between August and September's financials.
Okay,
Going into September's report, we met with 61 clients to file claims and stuff, and a lot of that's coming from the new registry, the new presumptives to Agent Orange and also to the Camp Lejeunes. So probably in the next 6 to 8 months, our appointments are going to continue to increase. We had 268 phone calls, 264 electronic transactions. We did 5 health and welfare checks. We did Vision 12 Mental Health Care Summit. That was Toma WebEx. Just discussing partners, best practices VA for creating and safe and welcoming environments for a diverse veterans population. We did the OTED, Virtual Veterans Suicide Prevention Symposium. That was put on by the national CVSO organization that state of Wisconsin is part of, which we're part of that. We have to be accredited with that organization. Then we did the mental health community action team again with Scott, with that team. October 22nd, we did the PACT ACT workshop from the national CVSO. They put on a training symposium for that, just covering different aspects of how to submit claims, when to submit them. And then August 30th, last Friday, we had our Southwest Service meeting, quarterly meeting training down in Lafayette County in Darlington. And we just talked about how we're going to attack the Agent Orange, Thailand burn pits, just going over other counties, what's happening in their counties and how they're attacking it. Any questions on that report? Oh, I forgot to mention, tomorrow is the my commissions, CVSO commissions meeting for the county with Scott Coburn at the American Legion. I'm sorry, at the VFW in town at 9:30 to 10:45, and that'll be on Zoom, and it's posted out to the public. If you want to attend in person, we'll be at the VFW. Any questions on that?
Do you know how many of the PAC-10 numbers we have in the county so far?
The what?
The PACT Act?
No, I do not, Marge. It's hit and miss with everybody moving in here, moving out. We're just getting a lot of phone calls trying to get appointments set to file, and a lot of the stuff is cancer. It's not, if they don't have presumptives to cancer, it's really a moot point to file until they have a diagnosis for that type of cancer. There's really nothing else they approve other than cancers.
Okay, thank you.
I'm also, I want to alibi there. I have next week we'll be up in Wisconsin Rapids for our accreditation. So we're going to be gone next week. The office will be closed all week for accreditation. So on that,
Okay,
so we can keep our PIV cards to work with the VA.
Okay, anybody else have any questions? Looks like that's it for you today.
Okay, and budget's tracking. I think I'm at 63% right now of my budget's spent so far.
Okay. Anybody have questions on the financials? We don't have anything today. Thank you very much.
Thank you. Have a good night, evening.
You too. Okay, you ready for the suicide walk?
Sure. So, Cody, do you want to introduce your staff? We're going to give a presentation about the suicide watch.
I have two staff members online this evening talking about our suicide walk. As you know, mental health, suicide prevention is something really big that we're trying to advocate for and raise awareness for in the county. It's also one of our top 4 priority areas that came out of our community health assessment. So Nikki and Suzanne are public health, community health specialists. They worked really hard on putting together a walk to raise awareness, to kind of put a dent in mental health and suicide. So I'm gonna have them introduce themselves, and they have a little bit of a conversation and discussion on what they want about to get this going and how much money they're raising for that. So Nikki, if you want to go ahead.
Yes, thanks for having us. So I'm Nikki, one of the community health specialists. And we're just going to start by explaining our planning for the suicide walk for 2022. So we started by convening a small group of individuals from Adams County, including someone from the sheriff's office, from Adams PD, medical examiner, Health and Human Services, YMCA, Gunderson School, and then the Rosha Cree Recovery Center. Then we looked at the 2019 event, which is the last time we've had our annual suicide walk due to COVID. We looked at the post evaluation and made some changes for the 2022 walk. So we started earlier. We decided to do no charge for food, and then we did pick up the day before the event so that the day up wasn't so messy. So we started asking for sponsors in May and received $2,150 in sponsorship money, which included 13 organizations. We opened online registration in June, which we used the Sheriff's Office online payment system, which it was our first time using that. It was for purchasing t-shirts, and it worked really, really well for us. There were 206 people that were registered online.
And I'm Suzanne. I'm the other community health specialist for the Division of Public Health. So we held the event at Friendship Park. It started at 9 a.m. this year, the first Saturday after Labor Day, which we started doing the same first Saturday after Labor Day for the last few events, just to keep it on everyone's mind that it's going to be the same day every year. The participants could choose between doing a 1.5 mile walk or a 5K run or bicycle ride. So the 1.5 mile walk went right along the main drag up to the middle school from Friendship Park and then back. And then the run and bicycle route went past ACEC and then down to County Road M and then back on the main drag. And there were signs along the routes with inspirational quotes and resources. We had a bunch of raffle items and silent auction items that were donated. So we had raffles and people bid on the silent auction items. And then at the end, when people came back into Friendship Park from the bike ride or the run or the walk, they would come back through the bridge if you're familiar with the park. And then we had a memorial flower ceremony. So we had flowers that were donated by ACE and Anchor Floral, and they could pick up a flower and then throw it in the creek in a remembrance of someone that they knew that had died by suicide. We had t-shirts for the event that we purchased from Eagle Promotions out of Boston. And the t-shirt design was designed by an Adams Friendship High School student. And then we had a speaker at the event as well, whose husband had died by suicide. And she talked about how it impacted her and then her own struggles with suicide and mental health.
So then as people came in and finished their walk, run, or bike ride, we had a resource table, a few tables put together, including volunteers from Friendship Connection, and they had a gun safe that they raffled off to one of the people that were at the event. And we also had food that was donated by Quick Trip, Subway, and Milk Source. There was supposed to be a magic show, but it was, the weather it cooperated with us, but it was about to rain right before the event. So we didn't end up having the magic show. However, we had a lot of good feedback that because it was at the park, there was plenty of things for the kids to do. Then we promoted the event heavily on Facebook, which was where the majority of people heard about the event.
There's I think it's like a food manufacturing facility called Millhaven Foods out of New Lisbon that had 15 employees participate, and then they matched proceeds of $1,950. So then money in for the event, which included sponsorship money, donations that we received at the event, t-shirts. So each t-shirt cost $10 for participants. And then the silent auction and raffle money equaled $7,700. And then money out, so the cost of the t-shirts, raffle tickets, Facebook ads, and any miscellaneous supplies such as like table covers, things like that, was a little under $1,700. So the total proceeds from that event was a little over $6,000. Does anybody have any questions?
Very good. Rick?
So what do you do with the proceeds then?
Yeah, that's a great question. What we've done in the past, this is probably the most money that we've raised from the event. Each year it keeps getting bigger and bigger. What we've done in the past is we've trained people to be QPR facilitators, so trained to facilitate suicide prevention trainings to community members. Myself, I'm one of the QPR trainers, and then there's a case manager within Health and Human Services that is as well, and we're working to get someone from the Sheriff's Office trained. So that costs a bit of money, and then what we're going to use for the rest of the money that's raised is going to be determined out of our mental health community action team.
Were you part of, I went to a volleyball game a week ago Thursday, and it was suicide awareness night. Were you aware of that, and did you help participate in that also?
Yeah, it's kind of been like a snowball effect. So we didn't participate in that, but we were informed that the students were going to raise money for us and donate it back to us. So that happened with that event that you talked about. And then there was also another volleyball tournament back earlier in the year that a group raised money for suicide prevention and mental health and then donated to us as well. And then there's a community like cleanup day coming up towards the end of the month that people are going to go around to local businesses and ask for money for suicide prevention and mental health as well, and donate the money back to us too. So it's kind of just been a snowball effect. People know that we're doing things related to suicide prevention and mental health and then keep donating back to us.
Any other questions? I'm not seeing any. Thank you, ladies, for a good program and a very nice presentation.
Thank you.
Okay, moving on. Oh, you get to take over.
All right. So the next thing is the June and July Health and Human Services financial report. I know Wendy is on the line. She has some information she wanted to update. Wendy, you want to jump in?
Sure. As Kelly said, you have the June and July financial revenue reports for this board packet. Next month, you will be getting August and September's financial reports. I did do a lookup today to see where we're sitting as of what's been posted from this morning. And a current update is that we are still a little bit over $100,000 in the black. And I think that's mostly expenses through September. So we're still holding our own.
Good. Great,
I have a question. When I was in admin finance the other day, they talked about the audit and it showed that we were in the red. Like 375 last year, and it's down to 52,000 if I'm not
For fund
mistaken,
balance.
for fund balance. Is there a possibility that'll be made up this year then if it continues like this or what?
Hopefully,
Okay,
I would say it's always contingent on, sometimes there are big costs come through later, like hospitalization costs. So hopefully, I don't know, knock on wood, so I don't jinx it. We've had a couple of years where we've been able to be in the black, which does really help pay off that significant fund balance. Any other questions?
move on.
All right, next thing on the agenda is the director's report and manager's narrative. Were there any questions related to the narrative?
I had one on ADRC. If you could bring that up, Ruth.
It's so, sorry.
Okay. Right here. On the second paragraph, it refers to 80% of the state and our county's local match, 80%. I don't, both 80%.
It should be 20%. Our match is generally 20%.
Okay, that's what I thought.
Actually, what Donna is implying, Donna, if you're on, correct me if I'm wrong, what you're implying is that we're using the 5310 grant as our 80% match for the vehicles. Donna, are you
Right.
on?
Yes.
So you'll remember that we asked the resolution for some ARPA funds for the 20% match. In the past, what we've used is our grant to cover this. match. Did
Okay,
I say that right, Donna?
Correct.
okay,
So we're not using levy for the match, we can use the grant.
right, I knew that, but I just didn't quite understand the sentence.
80% for the 80%.
Well, that's a good catch, Marge. You shouldn't have understood it.
Okay. I didn't have anything else. Does anyone else have questions on the report or comments? Boy, moving right along.
The next thing on the agenda is the 2022 project status report. Our goals continue to be the same. As far as our projects, I'll wait for the internet to catch up.
The camera's not picking up the whole group.
I have it on before, no.
Ruth, are you able to click on the bottom of that document that says HHS? You might have to look at your
I
screen.
gotta move this.
So you'll see, many of our projects, we just continue to keep working on them, updating them as necessary.
We probably want to update, if the budget passes, that purchase of 5 vehicles is gonna go to 10, the way they described. And me and Bob both said that, we'd be glad with 5 at this point, not cut it out, but we'd like to get 10, but it's a struggle to get 5 right now. So, and then they're gonna turn them over every 2 years, which is the talk, but like you said, you've been waiting for a year for 5 now, so.
I do know that we are in need of the vehicles.
Right.
We have a lot of competition to get the vehicles. We're starting to see some additional requests for mileage because they can't get a vehicle. They are heavily used. So one was in the shop needing a new engine repair, significant engine repair, so we're excited to get that back. So how would you like me to word that, or just?
I would just wait till the budget passes, and then if that stays in the budget the way it is in the capital project area, I think that we should then update that.
Okay, we'll do. Under trauma informed care, that was their first one that really has been a philosophy change for the agencies and that we've been working on. The managers, supervisors did attend, motivational interviewing, reflective supervision training last week on Thursday. And we're eager to get a handful of our staff trained in motivational interviewing. I believe later this month or early November. As far as our family-centered therapy, our family-centered treatment goes, that was something that Aaron's division, Children and Families, had received a grant for. The grant is coming to an end, and we're looking at our CCS program to be able to pick up that service array, so we can continue to offer that for families who need that.
Is that in the upcoming budget?
We're able to do that through the CCS service rate, so there is not a cost to do that. And then give reimbursement for it. Are increasing our internal CCS service array. We just hired a new mentor. We're very excited about it. And just excited about the services that can be on that. Continue to work on the paperless. You might recall that we had a new faxing process that Rich and his team implemented a few months ago. That seems to be really successful. It's really minimized paper output and streamlined actually receiving the fax information received, and not everyone had the access to it. So that was a really great change that we had. And then we continue to support our telework practices when and where it's appropriate, making sure that it is both benefit to our clients, consumers, programs as well as to. Any questions about this?
Seeing none.
And then moving on to reports of committee members. I asked Donna to give a quick update on the Aging Advisory Committee. Donna?
I just want to let you know that our next meeting is October 19th, which is next Wednesday after next, at 1 PM at the community center. We're going to be reviewing our board reports from August and September. We're also going to review our 2022-24 aging plan and the progress that we've made on that. We're going to be looking at our 8521 specialized transportation grant, our projects within that and our application for that. And we'll do our budget review in that meeting. I will give a full update on that at our meeting after this, Health and Human Services Board meeting. And then our ADRC governing board meeting, the focus on that right now is to recruit new members for the board member for that committee, as well as keeping the current members engaged. And we're just looking at some direction on that governing board right now and looking at updating bylaws and so forth. Anything else on that one, Marge?
No, that covers it.
I would just add that we are looking for people interested in sitting on the ADRC. Adams, Green Lake, Bushera, Tri-County, ADRC meeting. It would be, so if you have an interest in aging programs, or disability services, please let Donna know. As for the other updates, Coordinated Services Advisory Committee, we will be meeting tomorrow at 11 o'clock. So we'll provide a full update at our November meeting of the meeting that's tomorrow. And then Comprehensive Community Services meeting, and the last one was held on September 14th. And we were able to have our staff do a presentation and highlight some of the good work that they're doing here that other counties were interested in. So it's real positive. And that's pretty much all we for the meeting committees.
Any questions from the committee? Okay, hearing none, we'll move on. Cody, the overview of the 145 reviewing process.
We got a presentation with this pulling up. Before I start, just want to let you guys know if you want your flu shot after the meeting, come grab me after. I can do that for you. So the 140 review through our public health is a 5-year review that's done every 5 years through the state. So we had 6 state officials that came in to review our policies, our programming, everything from communicable diseases all the way down to other areas that we offer in public health. So if you want to go to the next slide, the purpose of this presentation is I'm going to go through some of the questions they asked us just to kind of raise some awareness and show you some of the programming that we do through and how we answer some of the questions. So as they stated, just some fun facts. The 140 review is done every 5 years. It first started here in Adams County in 1998. And there are 3 levels for health departments. So the level 1, a 2, and a 3. We are currently a level 3. If you want to go back one more slide before we move there. We are currently a level 3 health department, and my goal is to always remain a level 3 health department. You can go to so we do have a team of 6. We have 2 public health nurses. We have 1 contracted nurse that does COVID only. And then we have our 2 community health specialists, which you saw tonight talking about the suicide walk. And then we do have a public health support specialist. So our team is 6, including me, would equal 7. So what our public health team does is we cover the entire county, which is 689 square miles. So when the state came in and they reviewed our health department, they wanted to know what counties or what cities we have in our county and how we are affecting them through all the areas that public health works in. So here are some of the questions that they asked us, and to remain a level 3 health department, you have to offer so many programming. Now with COVID, we did lose some programming just because COVID took up a lot of our time. As you just heard, that we have a super small team. We only have 2 public health nurses, so a lot of our time became the vaccination efforts. So our major programming initiatives through Adams County Public Health is environmental health. They are programmed through an MOU through Wood County. We work hand in hand with them. We do a lot of public health emergency planning, communicable disease control, community health. So like our suicide walk, we work on mental health, access to care, and man therapy, just some programs, initiatives to kind of raise awareness and to make a dent in some of those areas. We also do vaccination services, a lot of WIC programming. So with our younger children, their parents bring them in, we get them up to date on vaccines, nutritional stuff there as well. And then we also have our huge program, maternal and child health, which is through lead, oral health. We do fluoride varnishes for their teeth. We also do car seats program. We offer safe sleep, prenatal care, and nurse family partnership. So just some of those programs right there will kind of move into our level 3 health department. So next slide. So another question that the state asked us is, what are some of the efforts that we are currently undertaking to identify and address factors impacting population health by implementing evidence-informed emergency practices? So you can kind of see the questions that they've asked us during the 140 review were quite complex. So what we like to do as a health department is we wanted to break those down. So during this process, we took 6 months to kind of review all of our programming, reviewing all of our partnerships, all of our data, all of our annual reports. So it took us 6 months to prepare for these questions and this review. And so for this question, we found out that our community health assessment, which is our CHA, we use that data to identify factors impacting population health. Our CHIP practice, which is our community health improvement plan, which we're working on right now, addressing factors of implementing evidence-informed emerging practices in CAT. So CAT stands for Community Action Teams. Another thing that we displayed to kind of show what we're doing to answer this question is our vaccine rates, our preventable diseases, access to care, Health First, which is kind of like STEs. They offer free testing, and by Vivint, which offers testing at no cost. So another question that the state asked us were, how are health problems, environmental, public health hazards, and social and economic risks that affect the public's health identified? So again, you can see our response by reviewing data and keeping in close contact with community partners. We have disease surveillance prevention programs that we use, such as WEDS. These are communicable disease reports that kind of go from healthcare providers all the way to us to kind of how we can maintain and prevent those diseases or make those better. They also keep them up to date on emergency diseases. We also maintain a relationship with state partners to keep us up to date. Verbal phone referrals, especially with environmental health hazards. For example, if there's a house that needs to be condemned, or there's some water treatment issues or concerns with the well, usually they'll reach out to us, and we'll get in contact with environmental health with county. Then we also use our yearly county health rankings to kind of determine health problems. So as you saw, mental health was one of the big ones that came through with our child this year. So. And then another question the state asked us, and kind of portray how we kind of responded here. They wanted to know how we developed and implemented interventionists intended to reduce the incidence for prevalence or onset of chronic diseases or to prevent injuries. So what are we doing as a health department the past 5 years? What have we done to kind of prevent some of these injuries? So we created CDR signs by beaches in different languages to offer after a person who couldn't speak English drowned. So we created warning signs such as, no swimming, look out for E. coli or blue-green algae. We created signs like that. Also, you might have noticed when you're on ATV trails or using some of our recreational parks, we posted to check for Lyme disease and look for ticks. We have signs also that benefit individuals like that as well. You might have heard Suzanne talk earlier about the suicide walk and QPR. We're getting individuals trained throughout the county and the schools to kind of raise awareness with that. We also do children's oral health, fluoride varnish program, our car seat program, Safe Sleep, which has been pretty big the past few years, our Well Women's program, community wellness programs, we have tobacco coalitions, alcohol and drug coalitions, along with nutrition and physical activity. So with this question here, the past 5 years, what have we done? These are some of the programs that we use to reflect that answers. And I believe this is the last one here, just a kind of an example of another question that they asked us. How have we used efforts to increase access to healthcare services for the jurisdiction? So as you know, one of our top 4 priority areas is access to care. So what are we doing to address that? So the past 5 years, we've used our chip. We've met people where they're at to drive in. So we had drive-in clinics for flu vaccines and COVID. We also have older elderly that can't drive to get their flu vaccine, so we'll drive to their house to do that. We also have options for services outside of business hours. We're working to schedule pop-up STI clinic testing, which would be free to kind of reduce some prevalence of those areas of STDs in our county. Again, we have flexible scheduling for flu shots, homebound clinics at local businesses. We have nurses that are available for WIC clinics that we come here in this RCH room to do. We also do lead testing and education, general public health information, and we base a lot of those off of referrals through some of our prenatal care there. And then we also offer community CPR classes, and then we do have about a 10% of a Spanish population here, so we utilize a clinic in Watoma that kind of speaks and translates to kind of help us with our language seasonal workers, so we can get them vaccinated as well too. It's more like the Grand Marche here. And then lastly, describe practices that we use for arranging the availability of services authorized. So a lot of the 140 questions are state statute questions that they've asked us through this review. So our 5-year response for this question for toxic substances, indoor quality and animal-borne vector disease and human health hazards. We have a lead investigation policy, indoor air quality investigations. We do water testing from bacteria to nitrates. We have a clean sweep program. We take complaints that are followed up on a timely manner. So we send those over to Wood County with any kind of environmental complaints from housing to anything outside. And then also we do equipment loan programs through the DHS that allows us to have the equipment to respond to the areas. So as you can see, even though my time here has been about a year, we did do a lot of programming in the past 5 years prior to COVID. So we kind of displayed our answers from 5 years up until this date. Our 140 review was in September. So you want to hit the next slide there. Just to summarize, so it did take our team 6 months to review and process all the questions that the state provided for us. So we took 6 months to kind of prepare and plan for this. After they conducted our review, it's a 3 to 4 week turnaround. So I believe it's been about 4 weeks now. So we're ready to hear back on the state on what level that our health department will be again. It's level 1, 2, and 3. Like I said, I'm expecting us to be a level 3 even with COVID. And if that's not the outcome that I want, I will always make it my goal for us to remain a level 3. So if we are not a level 3 this year due to COVID, I will spend the next 5 years trying to turn around to make us a level 3 again. Their audit and review of our health department was then sent to the state health officer. So once we get an official letter in the mail, they will tell us what level our health department will remain. So in summary, I just wanted to showcase some of the questions that the state asked us. And then I just wanted to give you guys some feedback on how we responded with our 5 years worth of programming that we've done. So that was just about a quarter of the questions they asked us. So as you can see, they were pretty in depth and lasted, I believe it lasted about 4 hours. So I will take any the state health officer for an appeal. Again, the only concern I have is that 2-year period where there was COVID, where we couldn't focus on programming. It was also before my time too, but we brought a lot of programming back now that COVID has diminished too. So I'm fairly confident that we will remain a level 3, and if not, we'll definitely appeal. So. Any other questions with?
Does the level affect any reimbursement or payments?
Very little financial.
I think it's a $5,000 difference between a 2 and a 3, so for funding.
And the difference between a 2 and 3 is the number of programs are required to operate.
Yep. And I think that you'll find a lot of health departments struggle with the 2-year lapse too, so we're not the only ones. I think we'll be fairly fine. So.
And it was also the state's direction.
So does that make any sense if you lose money because you don't have enough programming?
I'm not,
Take money away from,
I can't imagine that.
but you know what I'm saying? That makes no sense.
Counterproductive.
Yeah.
Thank you very much.
Thank you guys.
Very informative. Any other questions, anyone?
I would just say good work to Cody, because it's awfully hard to walk in on a 5-year certification when you are new in your role and in the midst of a pandemic. So good job to you and your team.
Yeah,
for
very
getting
good. And also thank you for keeping the board members appraised of our COVID.
Yep.
Solutions.
Thank you.
All right, moving on.
Yeah.
Our last, I guess, presentation is from Children and Family Services. Karen has a presentation put together with some juvenile or youth justice updates that also includes the community outreach program. That is, I believe, the last page of the presentation. Erin, are you ready?
Yes, can everyone hear me okay?
Yeah. Can you just have a-
Okay, very good. We lost sound there for a moment online, so thank you. And if you can't hear me, please, someone just raise a hand, okay? This is very brief. I won't keep you very long. But as you can see from the title, it's actually titled Chapter 938 Updates. It's going to touch on the community outreach program towards the end, but it's part of the larger picture. So next slide, please, Ruth. This is just, again, a reminder of what our structure looks like within our division. Myself, and then Karen, and then the people directly below us are who we directly supervise and the roles that we're responsible for. So as you can see, Karen directly supervises pretty much the front end work that comes into the division and sorts through that. And then when it moves on into needing court or it's unsafe or otherwise requires longer intervention, it then comes over to the staff that I directly supervise. So just wanted to give you a nice visual in case you haven't met some of the new workers as well. Next slide, Ruth. So there's 2 main jurisdictional components within Chapter 938. The first one that we'll talk about is the Youth Justice Program. And in 2016, the Department of Children and Families took over what used to be called juvenile delinquency, and really came up with a vision, a mission, and really provided a lot of supports moving forward as to what they'd like to see youth justice look like. So as you can see from this visual, which you may have seen before, the wheel on the left shows what the current youth justice system looks like, which is all of those children coming through the youth justice system who have different primary needs. They might be child welfare needs, mental health needs, or issues within the school, but they were all being funneled through the youth justice system. And the state wanted the system to look more like the one on the right. Children and families are getting their needs met where they should be met, and just those kids that need youth justice are coming into the youth justice system. And we'll talk a little bit more about that in the next 2 slides. Next slide, Ruth. This is just an overview of some of our statistics from the last few years. In 2019, the state started tracking youth justice cases through a database. And so we're able to actually pull real-time data out of the system and analyze it. And what the information means. So in 2019, we had 147 law enforcement referrals sent to us. Of those, you can see what the population of the children were as the makeup of those referrals. We were getting children referred as young as 4 years old for supposed criminal acts. 2020, we all know what happened in 2020. The number of referrals dropped by more than half. And then as schools started reopening, we see our referrals slowly creeping back up in 2021. And then starting in 2020, we're also able to start capturing data on our YAZI tool, which helps us determine risk levels with kids that have been referred to us. So that just shows you some of the more interesting data that jumped out is, like, for instance, in 2021, 66% of all of the children had a legal history. Their risk level in legal history was either moderate or high, and 71% of them showed a high risk in mental health. As you can see, that's pretty consistent. It's remaining very high. Our 2022 numbers go only through the end of August. That was the last month that I had complete data. So is there any questions about the data that we've pulled?
I have a question. When you say legal, under like 87 where YAZI pre-screens, that means they've already been in contact with legal authority once or twice already, same way with mental health then?
No, good question. So those are two separate categories. There's a variety of questions that really get asked and get assessed. And then it comes back with kind of a composite, determining whether a child's low, moderate, or high risk in certain areas. And so 66%, I'll actually touch on the legal one because that one really interests me. But for mental health, 71% of them came back as either moderate or high risk with their mental health needs. And then our response would be to make sure that they're connected with mental health services or evaluate that further. For the legal question, that's what is so interesting. If you look above it, so let's take 2021, which is the last year we have full data. Look at our population of children being referred to us. They're very young. They're under the age of 14 for the most part. It's primarily disorderly conducts, and a lot of them are occurring in the schools. So what we're looking at is really middle school age. I didn't put it up here, but the vast majority are also boys. So we're talking middle school boys are what come through our door. And so the younger they are, that automatically increases their legal risk on the YAZI. So if we get a referral for disorderly conduct at age 10, they come back to us at age 12 for another disorderly conduct, they're already automatically considered high risk because they've had a prior referral to our agency. So that does skew the data somewhat, or skews the outcome somewhat, but that is what it is. Does that answer your question?
Yeah, so in theory, that's what it is. They've been in the system once already with a disorderly conduct. So if they come in again, they're part of that 66%.
Correct. And it does increase if say it's not a disorderly conduct, say it's a battery involving an injury, that would automatically change some of the factors, changing their risk outcomes. Does that make sense as well?
Yes.
Okay. Very good questions. I'm glad you asked. I was just going to leave them there. All right, next slide, Ruth. So this one, I'm not going to go through these in detail. I just wanted to highlight. So since 2016, these are a lot of the changes that our division has made in response to either state or some federal changes as well. There's quite a bit of them. One that we're going to highlight on the next couple of slides are the Titans program. Let's see, the YAZI we've already talked about. That's our assessment tool that we use. We previously, Kelly talked about the family-centered treatment program. All of those things, most of these things I should say, cost the county very little. There's very little county tax levy that goes into this. Many of these things are simply practice changes that we've implemented that we think have had a significant impact on the outcomes for our kids. But the Titan program is the one I think you've heard talk about in the past. So that's the Teens Initiating Transformation Among Neighborhoods. So it came out of the same grant that's paying for the family-centered treatment program. We had some excess funding available, and we asked the state permission to use it to buy supplies so that we could start using the Titan program for some of our youth justice kids. So they continue to meet weekly every Wednesday. The grant supplies like meals, snacks, rakes, whatever is needed for some of the projects that they're working on, and the children get together with the facilitators. They do incorporate the ART program, which is spoken right above that on the box. And then they sit down and they kind of work on some skill building, and then they go out in the community and do some sort of project, whatever that may be. Sometimes if the weather's bad, they'll do it in-house. They might paint rocks, or in the past, they've done cookies for Meals on Wheels and things, but that's a program that we're very excited about, the Titan program. So Ruth will move on to the next slide.
Here, there's a question.
Oh, sure.
Supervisor Kozlowski here. I had a question regarding the last slide there. When it comes to mental health, who conducts the mental health evaluations? And then when that's conducted, if there is a mental illness found in the children, what is done from there? Or what kind of treatment do they give the kids?
Sure. So we do not conduct a mental health assessment. We simply have a battery of questions that we ask that give us an indication that mental health could be low, moderate, or high risk. And if it's determined that maybe they're coming back high in the area of anxiety or some other area, we would then engage them in mental health services and make referrals to those services. We don't actually, we don't do a mental health evaluation ourselves. We're not clinicians.
So can you just be more clear who does that then?
They would make a referral to our behavioral health division.
Okay.
Or provide resources if the individual or family wasn't comfortable coming here. They would provide resources to find this facility that they would be interested in going to. And then one step further, there was a court order or requirement to attend counseling that was determined necessary. Aaron staff and social workers would follow up and follow through of that child attending counseling or whatever therapy is recommended or determined to be necessary.
What kind of science do they look for when there's mental health concerns? What do they?
What do the social workers look
Yeah.
for? Aaron, what are some of the questions in your YASI that determine mental health?
Sure.
risk?
Sure. Well, so we don't ask outright questions. We're using motivational interviewing to really just gather information. And then with the family, we actually do this with the family. So we'll actually kind of ask the kids questions separately, the parents questions, and then bring them back together and finish filling out the YASI pre-screen form and really getting at issues that might concern us for, say, mental health or other issues. So I've got a handy dandy little book here. I'm trying to find the right page for you. And this is just the pre-screen. This is done to help us determine whether we need to intervene potentially further, or whether they need to go on to court, or whether it's something we could potentially look at handling informally. So this is done, actually, it's a nationwide assessment tool that's used for young offenders. But so one of the things here is looking to see if there's any indications of any of the following items, such as, do they have a diagnosis? You know, do they have an already diagnosed mental health issue? Then we would put that in there. We would put a note, whatever the parents or the child have told us. Do they have concerns for ADHD? That's considered a mental health diagnosis. Do they ever have suicidal thoughts? So we aren't going to necessarily say, do you have suicidal thoughts? We're going to ask questions that are going to help us get to that. And then if we have concerns, we would ask direct questions about that specifically. Have you ever had thoughts of harming others? So again, we're going to ask questions. So if maybe part of the referral was that they harmed someone, or were thinking about it or making threats, we're really going to dig into that and see if that was a real threat. And does that indicate a potential mental health issue? Let's see. Some of this just goes into whether they've ever basically had a traumatic event. We would ask more questions about that. Some of those give us indications. They're very similar to like the ACEs, the adverse childhood experiences, because again, we're talking about children. So we want to make sure we're understanding very early on what kind of concerns there could be. So is there anything else on that that you wanted?
One more question. Are they looking for symptoms of mental illness such as bipolar or schizophrenia? You mentioned a couple other illnesses. Are they looking for some illnesses such as that?
They could be. That could be something that is mentioned. I don't know that we would specifically ask questions that might be more of a clinical diagnosis of schizophrenia or bipolar disorder. But they could be talking about things, and a lot of times we get our information right from law enforcement and from the family. So we might ask, you know, are you hearing or seeing things that others aren't? And it doesn't necessarily, again, we can't diagnose for schizophrenia, but we would note that in our assessment that would be something that would need to be further evaluated.
Oh, I have. Thank you, Eric. Appreciate it.
Thank you.
Sure. Okay. Next slide, please, Ruth. Oh. Okay, so we've covered this one, I think, unless anyone had questions. I just wanted to show you the next slide again real fast. And that just again shows one of the projects that the Titan Youth did. The picture on the left shows one of the residents in the community wanted some assistance cleaning up their yard. So what the left is what it looked like. The middle is what the kids and the facilitators ended up doing. They ended up helping empty all of those milk crates into some dumpsters to help clean up the property. And when they were all done, on the right-hand side is what the property ended up looking like. So it's one of the visual ones that I think is easiest to share with everyone. So we really like that picture. If you have community projects that you think might be good, please send them our way. So the next slide then is the second area covered into chapter 938. It's called Juvenile in Need of Protection or Services. We call it JIPS for short. So there's a couple of different areas underneath this. It covers what's called the uncontrollable child. I have been here a very long time and I'm not quite sure what that means, but it is a category in statute. The second one is the habitually truant from school, and the subcategory is the school dropout. So as you're aware, we do handle truancy referrals here. Subsection 7 is habitually truant from home. Those would probably be considered a runaway, would probably be the language we would use. Sub 12 is delinquent act before the age of 10. So that would be like that 4-year-old that was sent to us. We wouldn't handle them. We wouldn't do a YAZI. We wouldn't send them to the district attorney, and we wouldn't send them to secure detention. We would process them under the statute that covers the JIPS, which is really just looking at what we need to do to support this kid. And maybe it does involve court action because the family needs something, but we handle those very, very differently. And then sub 14 is not responsible or not competent. So that would be a juvenile who's found by the court, not by us, by the court to not be responsible for their own actions, would then be sent out of the youth justice system and back to the JIPS system for us to work with. So what happened was in the fall of 2021, the Department of Children and Families and the Department of Public Instruction got together and actually issued some joint guidance as to how they wanted counties, in particular school districts, to start looking at kids who were considered truant. And so I'm not going to go into all of the details, but we took that information, and in working with our local school districts, we decided that we wanted to come up with the community outreach program, which I know I've spoken about previously. And they also, this joint guidance recommended the SRASR, which I'll talk about on the next slide. So I just wanted to give some updates on that. So our community outreach for student engagement, again, we used some prevention dollars that we have, and then some county or some of the ARPA funding to help contract with CW Solutions to provide us with a worker to start engaging families. We weren't using the definition of truancy. We were using chronic absenteeism really as our benchmark because we weren't sure how many students we needed to target. Again, it's not just the AF school district, it is the entire county, and we actually encompass quite a few school districts. So this began in January of 2022, so just a few months ago. The criteria is that the student has to be an Adams County resident. They must be in kindergarten through 8th grade. And then when we started, we again didn't know how many students, so they had to have had 10 or more unexcused absences the prior semester/trimester, and then 3 in the current semester or trimester. We just met with the schools right before school started, and we did revise that down and felt like we could actually take that down to 3. So if we had any students that missed 3+ days, the end of the 21-22 school year, and then currently have 3, that they could make the referral, and we felt like we could do our best work with it. So far, we've gotten 14 referrals from 3 different school districts. Sorry, I didn't move my pages, so my notes are somewhere else here. Each student and family does get the school refusal assessment administered, plus they're evaluated on 27 different factors, and I'll talk about them briefly on the next slides. What we found interesting, so we did a 6-month review when we were 6 months in to really see what we had. All of our families averaged having 18 different factors affecting attendance of the 27 factors. Our lowest family only had 12. And our highest, we had 2 families that had 22 factors affecting attendance, and we'll talk about those. And some of the conclusions that we were able to draw was that students and their families are really dealing with some real crisis level events, and therefore they're seeing school and education as a lower priority. And keep in mind too, these are rolling referrals. They weren't, we got 14 families all at once. These have been kind of rolling in through the end of the last semester and then starting again this new semester. Next slide, please, Ruth. So this, again, is what the school refusal assessment scale revised looks like. On the left is really, again, an assessment is administered, and there's a very easy questions. Things like, do you feel like you have a friend at school? Do you feel safe? Parent answers it, the children answer it. So they come back to these different domains to really target what areas we think might be impacting this child coming to school. And then on the right-hand side are the interventions that are recommended. And this was actually very difficult to kind of navigate. There wasn't a lot out there. DCF and DPI recommended the SRASR, but didn't have what interventions they were recommending. So we as an agency had to kind of put these together ourselves based on the research that's out there. And so that's what we came up with on the right. So say a child suffering from anxiety and they can't go to school, they can't bring themselves to walk into the school, what's going to happen? The right-hand side explains some of the basic interventions that you want to focus on to help that student come back into the school. Treatment for anxiety, understanding what their anxiety looks like, things like that. Next slide, please, Ruth. So of the 27 factors that we talked about, these are some of the factors that we called the youth factors. So again, 100% of them identified struggling academically. Not all of them, but some of them had disruptive behaviors at school. Some have behaviors at home. Some have identified mental health challenges or anxiety. And then a lot of them identify or having stress with peers, which we found is a common theme for their kids. They don't feel connected and they don't want to go to school. So that would be a target area that they would focus on. Next slide, please. The second category of some of the factors being impacted are what we call the family factors. So as you can see on the bottom, 100% of our families had issues using communication or lacking follow through. 75% did not have extended family support, or they have limited supports. 75% had generational attendance issues, which I don't think is surprising to some of us who understand the education field. And a lot of it comes down to some parenting, which is, again, would then be a target issue. If a parent can't control their child, we're going to focus on the parenting to make sure that the child can get to school. Next slide, please. So the last area that we really looked at were kind of external factors to the family, but that the family and the worker were identifying. And a lot of it comes down to, again, communication, helping the families really navigate how best to communicate with the school. For example, if my child is sick, I'm going to call the school and let them know. A lot of our families do not just do the simple thing like calling the school and letting them know. So starting with some simple steps, just using communication with the school and working with the families and how we're doing that, and vice versa. Again, a lot of the students identify not having a real connection with the school or not having an adult that they feel like they can rely on at the school. Let's see. And then again, struggling with academics. So this is just very small sample set, but these seem to be some of the factors that seem to coming throughout a lot of our families that have been referred to us. So the next slide, please, Ruth. So I just wanted to kind of summarize really some of the changes that have happened with in children and families with youth justice. A lot of what we did learn through COVID, how flexible we could be. We also have not had to use secure detention in that time since the pandemic. And we've learned that we can keep communities safe without using secure detention. We do have other tools available to us. From the YASI and youth justice reform, we can really focus our limited resources on our target areas that are needed. And then what we've learned from our community outreach so far is that we can have some positive impacts on families without resorting to legal interventions such as citations and court action. And then I always like to use Maslow's. It's a nice visual. So again, our division is really focused on the bottom two areas to make sure that children and families have some of their basic needs met. We can't move into some of those higher needs until we have food, clothing, shelter, safety, and security all met. Next slide. Just any questions? So this is a picture of a kid after they've done a large job raking leaves, just jumping in that leaf pile because they couldn't resist. So are there any questions?
Rick has.
I
Yes.
noticed twice, one was about 100% of the kids struggle learning and the other one was academic 88%. Is that because of teaching or whatever, or is that because of their chronic truism? Their chronic absenteeism?
So it would be difficult to parse that out because again, obviously not being in school is going to lead to you not doing well academically. But this is particularly under the youth. They are saying, I don't do well in school. And therefore that's a barrier for them to want to be in school if they're not doing well in school. That would be back a couple of slides, Ruth. So what we would like to see, obviously, if we can get them engaged in some sort of school curriculum, that could be a home-based curriculum as well, that we would see the academics improve. They would start seeing some success. And then hopefully we would start seeing some of this self-identified learning struggles come down. So it's not necessarily a reflection of this district curriculum.
Is there any other questions? Thank you, Aaron, for a good presentation. Yeah. Okay, is there anything else that anyone has?
I would like, I know she had a great flow chart of her staff with pictures and stuff. Is there any way that you can put that together for all your departments so we know who you're dealing with?
Does it have to be pictured?
Well, you don't have to be pictures, but I'd like to see at least a flow chart, so you by department, because it usually then, even if you have people vacant, so we know like when you buy. I'm lucky because I sit on ed and finance, we get to see where vacancies and stuff, but you have a lot of internal people moving up also. So it would be nice that we could see those things as they happen, I guess. If that's
Good idea.
possible.
I think we can figure something out.
We haven't done one for a while, so.
I mean, hers was great, I will say that, hers was great. So,
I can't guarantee pictures.
I don't care about pictures.
I don't want my picture on it. But no, it would be hard to get. But we do have a work chart, but maybe we can make it page by page divisions. And then would you want us to note if it was a change position?
Well,
Because we've had a lot of movement over the years.
I just would like it what it is right now, and as I see it, I can change my own. I just-
Josh, anything they can do for you?
No, not at this time, Art.
Right?
No, I like the word.
Yeah, and it's been a while since we had one. Okay,
Speedy Gonzalez.
We already have one together. I think we'll just continue to get into divisions because it's hard to read. And it's hard to. We can scale it down if we find division. Yeah. We can
And
have,
the vision would, I mean, I don't be a great, I just would like this.
we can have one.
we don't need to do that. Our next meeting is scheduled for November 14th. And if there is nothing else to come before this committee, we are adjourned. Thank you all.
Wait a minute, before we do that. November 14th, I want to say the county board meets on the 15th. If you have a resolution, do you want it earlier than that or?
I don't anticipate having any
Okay.
resolution.
Or I'm just saying, that we had something that needed to be on the board. Just throwing it out.
I will let, if we do, we'll let you know, but I think we should make that better.
But it was supposed to be on the 9th, but they're actually gonna have it on the following week.
On the 15th, what time is that meeting?
11,
9 in the morning,
9 in the morning.
9:30, actually.
There's a budget meeting. with November.
It's approved the budget. Just, oh no.
All right, thanks, everybody.
Have a good night, everyone.
You too. See you